All right, get ready to dive deep today because we are talking all about closing abdominal incisions.
No scalpels required.
Nope, no scalpels needed here. Just some really interesting textbook excerpts all about how surgeons close those incisions after abdominal surgery.
And it is a lot more complex than just, stitching things back together.
Yeah.
It's like this whole fascinating world of, promoting healing, preventing problems down the line.
Yeah, and speaking of down the line, like the source material really emphasizes just how vulnerable that wound is in the first week after surgery.
Oh, absolutely.
Like it's only at 5% of its normal strength.
Yeah, it's crazy.
So that those sutures are literally holding everything together while your body's, trying to catch up.
Yeah, it's almost like those sutures are acting as this little tiny scaffolding.
Yeah.
Just supporting the wound until the body can build its own permanent structure.
I like that.
And just like with scaffolding, the material really matters.
Yeah. And speaking of material, get ready to be surprised because there are tons of different types of sutures. Like we're talking synthetic versus natural ones that dissolve over time, others that put smooth single strands versus braided multifilament ones.
It's a whole world.
It's a whole world of options.
Yeah, and you might think that, a suture that stays in your body forever would be the strongest, right?
Right.
But that's not always the case.
Really?
The research shows that those non-absorbable sutures can actually cause more pain
Wow.
and even lead to sinus infections later on.
That's interesting.
Yeah.
So it's not quite as straightforward as you might think.
Nope, not at all.
And then there's this whole other aspect of it, which is like it's a microscopic battlefield against bacteria.
Oh, for sure.
So those smooth monofilament sutures, they're like a slip and slide for germs.
Yeah, they just can't grip on them.
They can't get a grip. And there was even a study in here that showed they absorbed significantly fewer bacteria compared to the braided ones.
Right, because it's all about, reducing those nooks and crannies where bacteria love to hide out.
Yep.
And speaking of weak points, the source material talks about how the knot itself is the most vulnerable part of the suture.
Oh, dear.
They call it the Achilles heel.
Oh, wow.
So knot security is absolutely crucial.
Yeah, that makes sense.
Luckily, those classic square knots, they're like the gold standard,
Yeah,
maintaining 90% of the suture's strength.
that's good.
But it's not just the suture itself.
Right.
The technique used to close that incision also plays a huge role.
Oh, yeah, for sure.
So the source talks about two main approaches, layered closure and mass closure.
Okay.
So think about it this way. With layered closure, you're carefully stitching each layer of tissue back together, like separately.
Right.
But with mass closure, you're grabbing all those abdominal layers
Right.
all together and closing them as one unit.
So it's like a more comprehensive approach.
Exactly. And when it comes to preventing hernias, mass closure is the clear winner.
Oh, wow.
Multiple studies show this. It's not even a close call.
Really? So that's like the gold standard then?
Pretty much, yeah.
Interesting.
And what's funny? The source material actually debunks a common myth.
Okay, what's that?
So, the peritoneum, that thin membrane lining your abdominal cavity,
Yeah.
stitching that closed might actually do more harm than good.
Really?
It can increase the risk of adhesions, which are basically internal scar tissue that can cause pain and complications later on.
So it's kind of like sometimes less is more.
Exactly. The
And then-
body has this incredible ability to heal itself.
Yeah.
And, sometimes interfering with that process can backfire.
Right. So if the peritoneum isn't the star of the show, what is it?
It's the fascia.
The fascia.
That's that tough connective tissue that really gives your abdominal wall its strength.
Oh, okay.
It's all about making sure that fascia can hold everything together.
Got it.
And it's not just about, stitching things up tightly.
Oh.
It's about understanding how the body heals.
Yeah.
So the source material talks about how this enzyme called collagenase actually breaks down some of the collagen in the fascia during those early stages of healing.
So it actually gets weaker before it gets stronger.
Exactly.
That's so interesting.
Yeah, it sounds counterintuitive, but that's why the choice of suture material and closure technique is so important.
Because it has to support that while it's happening.
Exactly. You need to support that wound while it's going through this, delicate healing process.
And here's something that I thought was really interesting. The length of the suture matters as much as the material.
Oh, yeah, absolutely.
So it's not just about how close together the stitches are, but also like the distance of each stitch from the edge of the fascia.
The stitch length.
And they found that shorter stitch lengths actually significantly reduce the risk of hernias.
Big time.
Wow.
The source material cites one study where they saw the hernia rate drop from 18% down to 5.6% just by changing the stitch length.
That is a huge
It's a
difference.
huge difference. It really highlights how even those tiny details can have a massive impact on patient outcomes.
That's amazing.
Yeah, it really shows the importance of surgical precision.
For sure.
And also, it emphasizes the need for ongoing research
Absolutely.
to continue refining these surgical techniques and improving patient care.
Yeah, and I think we've covered those like basics of sutures and the importance of closure techniques. Now let's move on to some of the specific ways those techniques are applied to different types of incisions.
Let's get specific.
All right, sounds good. So we talked about those building blocks, the sutures, the techniques. Now let's actually look at how those techniques are applied to different types of incision.
Oh, yeah, let's get into the specifics.
Yeah, it's like having different blueprints for different construction projects.
Exactly. Each incision comes with its own unique, considerations, and surgeons really have to tailor their approach.
Yeah.
Let's start with midline incisions. Those classic vertical incisions you see in all the movies.
Right. Those are the ones that are often used for procedures involving the intestines or other organs in the middle of the abdomen.
Yeah, exactly.
And we briefly touched on them earlier. But the source material actually goes into some fascinating details about how they're closed.
Yeah, one thing that really stood out to me was the emphasis on including the posterior rectus sheath in the closure. It's like adding that extra layer of reinforcement to a wall to make it more stable.
Oh, I see. So it's not just about closing the skin and the muscle.
Right.
It's about making sure that deeper layer of connective tissue is also secure.
Exactly. And when it comes to midline incisions, the source material really hammers home the importance of continuous closure with those slowly absorbable sutures to minimize that hernia risk.
So it's like building a superhighway for the healing process.
Yeah.
Strong, smooth, less likely to have any, detours into hernia land.
That's a great analogy.
Thanks.
And, minimizing that hernia risk is so crucial.
Right.
Hernias can cause pain, discomfort, even lead to more surgery down the road.
And nobody wants that.
Nobody wants it.
Okay, let's move on to transverse incisions. Those horizontal ones that are often used for gynecological procedures or surgeries in the lower abdomen.
Right, like a Fanninge style or a Cherney.
Yeah, like the stealthier cousins of midline incisions.
Yeah, they're a bit more hidden.
So the source material actually focuses on two specific types of transverse incisions, the Fannin style and the Cherney.
Right.
Both involve cutting through the rectus abdominis muscles.
Yes, those six-pack muscles.
But the Cherney takes things a step further.
It does.
So what makes the Cherney different?
So imagine those rectus muscles are connected to the pelvic bone by these strong tendons, right?
Oh.
With the Cherney incision, the surgeon actually detaches those tendons to get better access to the pelvic area.
Oh, wow. So that sounds more complex.
It is.
How do they put everything back together?
That's the tricky part. The surgeon has to reattach those tendons to the lower part of the rectus sheath. It requires a lot of attention to detail and strong, durable sutures to make sure that it heals properly and functions well.
So it's not just about closing the incision.
Right.
It's about really restoring that anatomical integrity of the entire abdominal wall.
Exactly, like putting a puzzle back together.
Yeah. And the source material mentions that either permanent or delayed absorbable sutures can be used for that reattachment, depending on the surgeon's preference and the specific circumstances.
Yeah, exactly.
So a lot of factors go into that.
There are.
What about the Fannin steel incision?
Okay, so the Fair style is a bit simpler because those rectus muscles usually naturally come back together after the procedure.
Interesting.
But if there's any separation between them, the surgeon might use a few loosely tied absorbable sutures to kind of guide them back into place.
Like gently nudging them back where they belong.
Exactly. And then the aponeurosis.
Aponeurosis.
That fibrous tissue covering the muscles that's closed with either interrupted or continuous sutures.
Got it.
Again, that choice between absorbable and non-absorbable really depends.
Right. Depends on the factors.
But the good news is the risk of hernia formation is generally pretty low with these types of incisions.
So the Fannin style seems like a good option when it's appropriate.
It is.
What about the Maillard incision?
Ah, the Maillard.
I remember reading that it's another type of transverse incision.
You're right. It is similar to the Fannin style, but it sits a bit lower, and it involves cutting through more muscle tissue.
Which makes sense, considering it's often used for procedures involving the pelvic organs.
Exactly. And because of that increased muscle involvement, the Maillard incision sometimes requires a closed suction drainage system under the fascia to prevent fluid buildup.
So this is where those drains we were talking about earlier come into play.
Yes.
It's not always necessary.
Right.
But sometimes they're crucial for preventing complications.
Exactly. And the source material really stresses that drains should always be placed through a separate incision,
Right.
not through the main incision itself.
To minimize the risk of infection.
Right, you don't want to introduce any unnecessary risks.
Makes sense.
So once that drain is in place, the fascia is closed typically with either interrupted or continuous sutures. The source material recommends using either permanent or delayed absorbable sutures,
Okay.
and even suggests considering a mass closure technique for additional strength.
That makes sense given the amount of muscle involved in a malar incision.
It does.
You want to make sure that area is well supported.
Yes, absolutely.
While it's healing.
Now let's talk about oblique incisions.
Yeah.
These are those diagonal incisions that surgeons often use for appendectomies or other procedures on the sides of the abdomen.
And because they involve splitting through muscle layers, I imagine they have their own unique closure challenges.
They do. The source material highlights that while the muscles themselves usually come back together naturally, surgeons often perform a deep, simple closure to provide that additional support.
So they might use a few loosely tied absorbable sutures to bring those internal oblique and transversus abdominis muscles back together. And then they close that external oblique aponeurosis with either interrupted or continuous absorbable sutures.
Right, it's like this multi-layer closure system.
Yeah.
And it's important to mention that when oblique incisions are used for treating, an intra-abdominal infection, a delayed primary closure might be necessary.
What does that mean?
It means they might not close the wound completely right away.
Oh, yeah.
They might temporarily close the skin with staples.
Got it.
Which can be easily removed later.
So it gives the area a chance to heal from the inside out.
Exactly.
Before sealing it up.
Yeah, it's pretty smart.
It is, and it just goes to show how much thought goes into closing these incisions.
Definitely.
It's not always as straightforward as it might seem.
Yep.
We've covered a lot of ground here.
We have.
From midline incisions to transverse and oblique. It's amazing how many different techniques are used, depending on the type of incision and the situation.
It really highlights the complexity of surgery and all the careful considerations surgeons make.
Right, to ensure optimal healing
Yeah.
and minimize complications.
Exactly.
And speaking of minimizing complications, let's move on to a topic that often causes a lot of confusion and anxiety for patients.
Oh.
Surgical drains.
Yeah, those little tubes sticking out after surgery, they can be kind of unsettling.
Yeah, they can be a bit of a mystery, honestly. And sometimes they cause unnecessary anxiety for patients, but they definitely have their place in surgery.
Yeah.
And the source material gives some good insights into their, evolving role.
Well, and one thing that really stood out to me was this idea that drains aren't always necessary.
Right.
Which seems counterintuitive.
Yeah.
But good surgical technique can actually make them redundant.
Absolutely. It's a good reminder that skilled surgeons, they're always working to minimize the need for those extra interventions.
Right.
And the source material really emphasizes how, meticulous hemostasis, that's stopping bleeding effectively,
Right.
and gentle tissue handling during surgery.
Yeah. Those things can significantly reduce the need for drains.
So it's like if you build a house carefully and make sure there's no leaks, you don't have to install extra drainage systems.
That's a great analogy.
And plus, those drains themselves can introduce risks like infection or even delaying the healing process.
Right, exactly.
So it's a delicate balance.
It is.
Surgeons have to carefully weigh those potential benefits against the potential risks for each patient.
For sure. And that's where the source material offers some helpful guidance.
Okay. Yeah.
It outlines some specific situations where drains are particularly beneficial.
Like after surgery on organs like the liver or the pancreas,
Yeah.
where there's a higher risk of fluid buildup.
Exactly. Those organs tend to ooze more fluid after surgery, and a drain can help prevent that fluid from accumulating and causing problems.
Right.
And another situation where they're super helpful is if there's a concern about a leak from an anastomosis.
An anastomosis, remind me what that is again.
It's basically a surgical connection between two structures. Like when you're reattaching parts of the bowel after removing a section.
All right.
And a leak at that connection point could be serious, so a drain can help monitor for any leaks.
Right.
And allow the area to heal properly.
So like having a little watchdog in there.
Exactly.
Making sure everything's flowing smoothly.
And one more thing the source material mentions is that drains can be used to irrigate infected areas with antibiotics.
Oh, wow.
Which can really help speed up healing and reduce the risk of that infection spreading.
So they're really versatile tools.
They are.
It's not just about removing fluids.
Right.
They can prevent leaks.
Yeah.
They can fight infection.
Exactly. And that brings us to another important aspect of wound care.
Oh.
Dressings.
Dressings.
You might think dressings are just about, keeping the wound clean and covered.
Right, keeping it protected.
But it's way more nuanced than that.
Oh, really?
The source material highlights some really cool advancements in dressing technology.
Okay, I'm intrigued. I always thought a dressing was just a dressing. What's so special about these new ones?
Well, one of the biggest shifts has been toward these, modern semi-permeable dressings. So unlike traditional gauze dressings, which can trap moisture,
Right.
these newer dressings allow moisture vapor to escape
Oh.
while still protecting the wound from, outside germs.
So they kind of let the wound breathe,
Exactly.
but still keep it safe.
And what's fascinating is that this seemingly simple change has a huge impact on wound healing.
Yeah, the source material mentions a study where these semi-occlusive dressings actually led to faster healing,
Yes.
reduced pain, and even less scarring
It's amazing, isn't it?
compared to those old-school gauze dressings.
Something as simple as the type of dressing can make a world of difference for patients.
Yeah, it's really encouraging to see how these advancements are directly translating to better outcomes.
It is, for sure.
Yeah.
So as we wrap up our deep dive into abdominal incision closure,
Yeah.
what are some key takeaways that stand out to you?
Well, first of all, I'm just amazed by the complexity and precision involved in closing these incisions.
Absolutely.
It's not just about, stitching things back together.
Right.
It's about really understanding the anatomy, the healing process,
Yeah.
the potential complications.
That's a great point. And remember, there's no one-size-fits-all approach.
Right.
Surgeons have to consider all sorts of factors,
Yeah.
the type of incision, the patient's overall health, the potential risks and benefits of different techniques and materials.
It really is an art and a science.
It is.
And the constant evolution of techniques and technology like those new dressings we talked about is super exciting.
It is very cool. But even with all these advancements, the fundamental goals remain the same.
Yeah.
Provide strength and support to that wound while minimizing the risk of infection and other complications.
Right.
Ultimately, it's about helping patients heal quickly and safely so they can get back to their lives.
Well said. I think we've given our listeners a lot to ponder
I think so, too.
about, what goes on beneath the surface, literally,
Yeah.
when it comes to abdominal surgery.
And if there's one thing I hope our listeners take away from this deep dive, it's that knowledge is power.
Yes.
The more you understand about your own body and the procedures you might undergo, the better equipped you'll be to make informed decisions about your healthcare.
So keep those questions coming and never be afraid to advocate for yourself and seek out the information you need.
Exactly. Keep diving deep into the world of science and medicine.
Yeah.
There's always something fascinating to discover.
Until next time, stay curious and happy healing.